One question that I see often on many Facebook group pages, as well as a question that I get often from my clients is, Dean, my MRI came back clear, yet I definitely have sciatica. Why isn't it showing up on an MRI? I love answering questions just like this from people like you who are searching for answers and searching for relief from their sciatica. Hey there, my name is Dean Volk. I am an international sciatica relief expert, and I love answering questions just like this one for people just like you. So the big question is, why am I having sciatica even though my MRI does not show a bulging disc, a herniated disc, any problems in my SI joint, no stenosis, and I have normal aging related things, but nothing that shows a nerve being irritated? This is a common conundrum for people with sciatica. And just as common as this is I have seen people's MRIs come back with severe stenosis due to herniations or big bulges to one side of their spine, even though all their symptoms are on the opposite side, which does not coincide with what the MRI says. There are a lot of limitations to the MRI, even though patients try to demand to get them done as soon as possible because they think it will be the answer all. I have a good friend who had a MRI read by an orthopedic surgeon, and when he came to the orthopedic surgeon's office, the orthopedic surgeon thought that he would see a man in a wheelchair, but the man was walking in and he was shocked. And he even asked him, "How are you not in a wheelchair?" And my friend told him, "I don't have any back pain, I don't have any leg pain, never have." And that was 15 years ago and still doesn't, even though the MRI was one of the worst that this orthopedic surgeon had ever seen. So many times the MRI and the symptoms do not correlate, and the MRI is actually pretty worthless. Another thing you need to keep in mind is if you get an MRI result and it does correspond identically to what your symptoms are, say a bulge or a herniation to one side or stenosis to one side of your spine, whether it be the left or right side, and your symptoms are on that side, you've got to remember, if you don't have pain when you're laying down and your MRI shows that your nerve is being pinched by whether it be stenosis, whether it be a disc, whether it be from anything, but you don't have any pain in that laying down position, is that MRI really showing you anything? I would say it's not, because according to the MRI, you should be having pain while you're laying down. Many people have no problem getting into the MRI machine because that is a comfortable position for them. Other people, it's a outrageously uncomfortable position, but I'm just talking about correlating the MRI results with your symptoms. So it is not uncommon to have sciatica issues or nerve issues without it being seen on a scan. Scans are not foolproof. They are just one snapshot of your back in one position in one moment in time. Has nothing to do with the way you sit, has nothing to do with the way you are walking around. If your pain is only in sitting, or your pain is only in standing, or it's only when you sit and stand, or any combination, when you're laying down on your back getting a picture taken, the discs and the spine are in a different position. And as you move, you don't know how that disc, how that spine is going to actually move. Though you got to admit, if you've got a herniation to the right side and all your symptoms are on the right side and it's the same corresponding level and the area of your leg that corresponds to the area in the back where your symptoms are, all right, you may have a match. The great news for all of this is it doesn't matter what your MRI shows. If you get the right treatments, take the right treatment approach to calm down the body, to calm down the symptoms and allow the body to heal, does it really matter what your MRI shows? And one other piece of my thinking for food for thought. If you have not had an MRI in the past, let's say you woke up today, which is Wednesday, July 13th. Let's say I woke up in severe pain today. And within a week, I'm demanding an MRI and I get the MRI and it shows some stenosis, it shows some retrolisthesis, it shows some disc bulging. But I have no pain when I lay down, it's only when I stand up. There's nothing to compare that to if I've never had an MRI before. So I may have had the same exact findings on an MRI 2 weeks prior, 2 months prior, 2 years prior than I do today or whenever it is that I get this MRI? And if there's no change in the MRI, but my symptoms are changed significantly, does that MRI really hold any weight in trying to determine what the problem is? Or are the results of that MRI irrelevant to my symptoms? Just some food for thought, because I don't take people's MRI at face value, especially when they're not correlating with somebody's symptoms. But what I do focus on are patients' symptoms, because to me, if I can take care of somebody's symptoms and knock them out, eliminate them, and get those symptoms down to a tolerable or even irrelevant level for their life, does it really matter what their MRI shows? Just some food for thought. If you enjoyed this content, please give me a thumbs up. Please hit the subscribe button below as well, so that I can get answers to you on a weekly basis. And if you are dealing with sciatica and are looking for some help, I do run a sciatica relief group. It's called Sciatica and Piriformis Syndrome Relief Group on Facebook. I'd love for you to join. And if you want to get in touch with me, you can reach out to me at info@sciaticareliefnow.net. Would love to be able to talk to you. There's my website. Check it out. Let's get you on the road to recovery.